Okay, now it's rolling.
Hey guys, this is Eric, and this is my attempt at a video for you guys. I was going to try and make this a production above, that's my buddy right there, production beyond compare, but since I have to have my 11-year-old program my cell phone and do that kind of stuff, this is about what we're going to get. Anyway, the hospital, Mary Lanning Hospital, that's the facility that I wanted to talk about in Hastings, Nebraska. First, to tell you a little about Hastings, Nebraska. It's a community of around 25,000 in south central Nebraska, and we create one of the tri-cities between Grand Island, Kearney, and Hastings. We've got a lot of agriculture in this area, and we've got a lot of packing houses. So we have a very diverse culture in all three communities, as far as a lot of Hispanic immigrants, a lot of African immigrants that work in these packing houses. One of the facilities employs over 2,500 people. Anyway, the facility I wanted to talk about is Mary Lanning Hospital in Hastings. That's about a 150-bed full-service hospital. They have their own cancer center. They have everything a huge hospital would have. And we talked to their social worker, the head of their social work program there is Pat Turn, and we talked a little bit about the program and what kind of things a social worker does in a hospital setting. The main thing that the social workers do at Mary Lanning is discharge planning. They go about with the patients as they're discharged from the facility, and they go through and they help plan what's going to be the next step once they come out of the hospital. Are they going to need home health? Are they going to need hospice? Are they going to need physical therapy? Are they going to need counseling? Elderly services. They work with the nurseries with babies coming out and plug them into the community, into the programs for taking care of newborns, especially with young mothers. They are basically a source of resources for the population that they serve, and that's what the social worker does in the hospital settings. One difference between maybe what the social worker in the hospital and like Mary Lanning does compared to maybe the social worker that's working for Department of Social Services and has a long-term relationship with a client. These guys have more of a short-term relationship with their clients. They're there for a surgery, or they're there for an actual need, and once they're discharged, once the social worker has placed them back in the community, then they're finished with them. They help people get what they need in the community. It's just the short and long of it. They also do a lot of emotional support, a lot of listening for the family members that are in the hospital. They said one of the main things that they have when they're dealing with end-of-life issues, or they're dealing with patients that might have to be put on ventilators, or they may have to be unplugged. They have to deal with family members. If there's not a living will, there's a lot of conflict that could be involved in that, and they act as mediators between the family members and try to come to a consensus on how they're going to handle that situation with that individual family to do what's best for the patient. They handle the case management for the mental health ward in the hospital, and they do a lot of referrals as far as drug and alcohol treatments, mental disorders, and they do the case management for that. They use a lot of tools. Some of the tools that they use, they have their own language line because we have such a diverse population and all the different cultures, different languages. If someone comes in and the social worker doesn't know the language, they can plug right into the language line and get an interpreter and take care of that barrier right away. I don't want to be real long-winded because I know this was supposed to be 5 minutes, but This is the facility I believe I'm leaning towards trying to get an internship with once I get to that point. Hopefully I get to that point. My wife's an RN and she works for home health for Mary Lanning for that facility. And I know a lot of the people that do work in that facility. Other than that, that's my video. It is what it is. Have a good day.